Hi, I'm Yosuico, and with me is Dr. Eileen Manalo. She's an active consultant with the Asian Hospital, the Makati Medical Center, the CARMI Fertility Center of St. Luke's Medical Center in Global City, and of course, the University of the Philippines, Philippine General Hospital. Dr. Manalo, we're so happy to have you.
Thank you.
So we have two questions prepared for you, and let's go ahead and start with the first one. Yung first question po natin is, ano ang bisang gamot sa irregular menstruation?
Well, yun na nga, hindi naman tayo basta-basta nagsasabing gagamutin, di ba? Kailangan mo na malaman kung ano yung sakit ng tao. Pero, ang pinaka-common kasing reason kung bakit irregular menstruation is what you call polycystic ovary syndrome. So, it's the most common cause of hormonal imbalance in women in the reproductive age. So, it is characterized by irregular menstruation, signs of androgen excess. So, androgen is a male hormone, so that will manifest with hairiness, oily skin, pimples. And then if you do an ultrasound on these women, you will see that the polycystic looking ovaries. You have enlarged ovaries with about 12 follicles measuring 2 to 9 millimeters in diameter. Kaya tinatawag natin polycystic. So with polycystic ovary syndrome, then what you do is you just want to regulate the menstruation kung ayaw pa nila mag-baby, and then kung gusto nila mag-baby, then you give them fertility drugs. So to regulate the menstruation, then you can give pills or you can give progesterone in the second half of their cycle to bring about regular monthly menstruation. But it's also important to address other issues. Usually these women are obese, mataba, no? So half of these women are, in fact, 60% of patients with PCOS are obese. And so weight loss is part of it. So for some, just the weight loss can regulate the menstruation. And so that's really part of our counseling for these women.
So talaga pong merong lifestyle factors involved
definitely.
in some of these cases.
Definitely, yeah.
And of course, before taking any medication, they have to see their doctors.
Yes.
To be able to get
of course. I mean, at the end of the day, if you have irregular menses and if you have a boyfriend and you're sexually active, the first thing you think of is a pregnancy until proven otherwise. So we don't just give any medication. You have to examine the patient first.
Okay, thank you. So, yung mga audience members po natin, they sent in their questions. Tapos ito po yung case that we'd like to pose for you. So the question is, kapag impotent po ang isang lalaki, anong supplements po ang pwedeng ibigay sa kanya? Thanks.
Well, the thing is nga, hindi na natin ginagamit yung word na impotent, no? So, the more politically correct term is infertile. Ibig sabihin, isang taon na sila nag-try mag-partner o mag-asawa na makabuo, pero hindi makabuo ng baby, no? So, so you have to do a semen analysis and try to find out if there really is some problem with the male factor. And if you do find that, then yun, we can give supplements. Usually, mga means C, A, C, and E, okay, and then zinc, or we can give also glutathione, L-carnitine, CoQ10. So these are antioxidants which can help improve the motility, also even the count of the semen parameters of these men. But at the same time, lifestyle changes would be very important. So we always emphasize, if they're smoking, please do not smoke. If they are overweight, to lose the weight. If they're involved in too much exercise, to cut down on the exercise. So these are very important things that you have to harp on in these patients. Likewise, if they're taking too much alcohol, you want to tone down on that alcohol kung pwede nga wala. And even caffeine, you know, for some, we tell them to cut down on the caffeine or do away with caffeine altogether. So these are lifestyle modifications which are very, very important in improving the sperm quality.
And Doktora, ang dami niyo pong nabanggit that's very, very important on the male side of the couple, right? I mean, it's not just the female that needs to make some of these changes, but also the male.
Exactly.
Would you like to elaborate a bit more on the male participation in the process? Because throughout the day, we focused a lot on, you know, what women need to do, the healthy lifestyle, the diets, and all of those things. But men bring a lot, apparently, to the infertility equation.
Well, half of the equation is male, right? So most often, I mean, you know, we do find problems with the women, but what if you're dealing with a man with a very low count or low motility? So these will have to be addressed. And a lot of times, the answer is you don't know. You don't know how to deal with it. You give the supplements. You get to the root of the problem. If there's diabetes, then you correct the blood sugar. If the person's obese, you make them lose the weight. If they're involved in too much exercise, you make them cut down on the exercise. But at the end of the day, We also offer insemination, so assisted reproduction. And so this is literally bringing the sperm closer to where the egg is to try to improve on fertilization and pregnancy. But if the count is very, very bad, because you need at least 5 million motile sperms to achieve a pregnancy with insemination, then test tube baby would be the next thing to do. Likewise, if the woman is elderly, in other words, she's 42 years old, you don't have enough time to correct all those problems, then you go straight to IVF. So these things you have to take, talagang you have to individualize the problems of the couple. No, there's no hard and fast rule for all the patients.
So, I'd like you to sana emphasize that a bit more. Wala pong one-size-fits-all
Correct.
answer. Hindi po ganun kadaling sabihin kung ano po yung dapat na gawin ng lahat ng mga nag-iisip na may problema sa infertility. Would you like to elaborate on that? Ano pong kailangan nilang gawin to make sure that it's an individual approach to their problem?
Well, they really have to see the proper doctor. Ang problem kasi a lot of times, they see non-fertility specialists. And so sometimes, the patient's already 40 years old and she's been seen by a non-fertility doctor for 1 year. By the time she gets to us, medyo hindi na ganun kaganda yung ovarian function. No? And so you're left with little to do for the patient. So again, seek proper help, and then you can be guided. Of course, you want to get to the root of the problem, and then you resolve this problem. If the problem is anovulation, then we give fertility drugs. If there's a tubal problem, we see if we can correct it. But otherwise, if both tubes are really bad, then we resort to doing IVF. So there are so many ways by which you can solve the problem, depending on what the problem is. If you have huge myomas, these are fibroids, mga malalaking bukol sa uterus, which bring about inability of the sperm to enter the uterus or prevent implantation, then they will have to be removed. So the problem has to be addressed individually.
Doc, last question, sorry, kasi there's so much that you're sharing. I hope it's okay. There's a lot of cultural, I guess, difficulty in discussing infertility. Do you find that to be the case with some of your patients?
I think our patients now are more aware, and so more and more they're coming to our clinics. But there are still some patients who take time before they see the doctor. Before also, the men wouldn't want to participate, so it's very hard to, sometimes you've been taking care of the woman and you haven't even seen the man, but now it's usually the couple that sees us, and that's very, very good because you can start your treatment and you can work on them at the same time, because time is of the essence, and what you want is to cut down on the waiting period between seeing the patient for the first time and trying to get them pregnant. And remember, it's not just getting them pregnant, you want to make sure that they have a baby, because that's your goal, to give them a baby, not just to get them pregnant.
Yes.
Yeah.
Okay, thank you so much, Doc, for joining us on Baby Goals. That's so very helpful. Everything
you.
that you shared. Sana natulungan natin yung mga couples na madaming tanong tungkol sa fertility. Thank you, Doc, again for joining us, and thank you for watching. We hope we helped you with your baby goals.